Hi, Dr. Masa at L.AC Chiropractic Clinic. Today's topic is tennis elbow. Tennis elbow lateral epicondylitis is painful condition that occurs when tendons in your elbow are overloaded, usually by repetitive motions of the wrist and arm. The pain of tennis elbow occurs primarily where the tendons of your forearm muscles attach to a bony bump on the outside of your elbow. Pain can also spread into your forearm and wrist. Despite its name, athletes aren't the only people who develop tennis elbow. Causes: tennis elbow is an overuse and muscle strain injury. The cause is repeated contraction of the forearm muscles that you use to straighten and raise your hand and wrist. The repeated motions and stress to the tissue may result in a series of tiny tears in the tendons that attach the forearm muscles to the bony prominence at the outside of your elbow. As the name suggests, playing tennis, especially repeated use of the backhand stroke with poor technique, is one possible cause of tennis elbow. However, many other common arm motions can cause tennis elbow, including using palming tools, painting, driving screws, cutting up cooking ingredients, particularly meat, repetitive computer mouse use. Symptoms: the symptoms of tennis elbow developing gradually. In most cases, the pain begins as mild and slowly worsens over weeks and months. There is usually no specific injury associated with the start of symptoms. Common signs and symptoms of tennis elbow include pain or burning on the outer part of your elbow, weak grip strength. The symptoms are often worsened with forearm activity such as holding and toss the frying pan, turning a doorknob, or shaking hands. Treatment. Treatment has two parts. First one is non-surgical treatment and second one is surgical treatment. Non-surgical treatments are rest. The first step toward recovery is to give your arm proper rest. This means that you will have to stop participation in sports or heavy work activities for several weeks. Using a brace can reduce symptoms by resting the muscles and tendons. Non-steroidal anti-inflammatory medicines. Drugs like aspirin or ibuprofen reduce pain and swelling. Steroid injections. Steroids such as cortisone are very strong anti-inflammatory medicine. Physical therapy. Specific exercises are helpful for strengthening the muscles of the forearm. However, even its non-steroidal anti-inflammatory medicines have a risk of side effects. And also, steroids have more severe side effects such as bone getting weaker and cartilage is less and less by steroids. Therefore, we highly recommend before you use those drugs or even surgery. Try acupuncture, which is safe and effective to reduce the pain and inflammation without any drugs and surgery. So today I will teach you your self acupressure to the acupuncture point for reduce the pain of your tennis elbow, the end of this video. First, I check the condition of the patient. Ask her to make a fist, then extend the wrist like this, and I resist it. When she feels the pain during this motion, it's a positive sign. Okay, extend it. There's a pain. So this is positive sign. And next one is ask her to keep her finger straight. Then I try to drop the finger like this. And if she feels the pain here, it's a positive sign. Okay? Keep your finger straight and resist. Is that pain? Yes. This is positive to tennis elbow. Then observations and palpations, and of course I have to ask when it starts, how it starts. If it's injury, maybe I will take X-ray to make sure her bones are okay. But if not injury, probably we don't need X-rays. It depends on the situation and condition. And also, as a Japanese style acupuncturist, we do not treat only the part the patient have symptoms. Usually we do pulse and face and tongue and arms and back, and check what meridian is too strong, what meridian is too weak, and then try to fix those imbalance of ki, the energy flow. But at this point, I just show treatment of the arms and elbows. Here is Gokoku. Is a pain reduction acupuncture point. And next one is Te Sanri. And this one is Kyokuchi. And last one is Te Gori. And keep this condition 15 to 20 minutes. When patient have severe pain, we put the additional stimulation. This is one example. I put an electronode and using electromuscle stimulator. Not only acupuncture stimulation, but also those electrostimulation give more pain relief and muscle relax and better blood circulation to enhance healing. Another option for severe pain patient, we hook up the cord directly to the acupuncture needles and using pulse generator to put an electric stimulation through the needles. This is more strong stimulation to acupuncture point for better result. However, patients do not feel pain by electrostimulations because the needle is tiny, thin Japanese style needles, and we do not put too deep the needle inside. And then electrical stimulation is within patient comfort zone. This is a second option for better results. Also, some patients are afraid needles. We have an option for that. This is acupuncture needle for Pediatrics. So it's not real needles, it just touch the skin, so no pain. This one also pediatric acupuncture needles which is not penetrate the skin. And L.Ac, this is not penetrate the skin neither. Stimulate acupuncture point like this. You can see the skin color change a little bit. The body react to the stimulation. It's a good sign. This kind of gentle stimulation is good enough for some very sensitive patient. Strong stimulation is not good if it's too much for the sensitive patient. Another option for sensitive patient who are afraid needles, infrared laser. This laser beam go into the acupuncture point and gently stimulate, but no pain at all. Like this. Home care for your tennis elbow is three kinds. First one is using ice pack or cold pack, or even you can prepare a Ziploc and ice cube in it, then apply to your elbow like this and hold it 20 minutes you can do 3 times a day, but you should be very careful with frostbite with this. Second one is stretching. Bend your wrist like this and hold with other hand and pull a little bit and feel tension here is good enough. Okay? Then keep breathing and hold 20 seconds. Then release it and rest a little bit and do 3 or 4 times as a one set. You can do this maybe 3 times a day. And third one is acupressure. Acupuncture point is here, it's gokoku, which is between your thumbs and then second finger meet together, and where you feel little tenderness when you press. And keep press like 3-4 seconds and release it 5 times as a one set. Also, when you bend elbow like this and then you can see the wrinkles here is ended, here is another acupuncture point named kyokuchi. So press and hold 3 or 4 seconds and release it, and 5 times. Those acupressure you can do 3-4 times a day. Okay? So pressure is within your comfort zone. Do not press the area you feel pain. Okay? If it not help, sometimes too much stimulation directly on the inflammation site, it's getting worse. So be careful. But acupressure, stretching, icing may help. So try this, and also when it's not enough, you should try Japanese style acupuncture treatment. It's a gentle, effective, cost-effective alternative treatment, and it's very safe. Almost no side effect. Thank you for watching. Bye now.